Hi, it's Everyman Tactical again today, and today I'm going to be going over the individual first aid kits, blowout bags, whatever you want to call them. It is a small medical pouch or container that is for your own use when you have had trauma inflicted upon you. It is close at hand. This is not something you keep in the trunk. This is something you'd keep up on your person or in the center console. Something easily reached. In a tactical situation, you wear it on one of the sides, and it will prolong your life pre-hospital. So I'm going to go over just the basic fundamentals of what should be in your kit. And in front of me, I have my small kit here. This is my one that I carry on one of my rigs when I'm home. And first thing, absolutely necessary, is one of these. Okay, a majority of firearms or fatalities in warfare are from extremity wounds. Okay, and an effective tourniquet will save your life. It's been drilled into my head, it's been drilled into soldiers' heads, it's been drilled into everyone's heads, and civilians really need to get on board because now these are even being issued to police officers and medics and everything. This is a soft C Model 2, it's the wideband. These are a little bit pricier, but they are worth the money. These are highly effective, easy to administer, and I make sure it stays somewhere where it's the first thing I can grab. It sits right under that flap. I can yank it and pull, and I've got my tourniquet, and then it just pulls open. Always keep them ready to go. Don't leave them in the package. Don't leave them unhooked from themselves. Here's another example. This is a cat too. You see, this is a tourniquet here. Right here, don't buy the Chinese knockoffs. They just snap, they break, they stretch. They're horrible. You know, you can't practice with these. You can't practice really with any of these tourniquets. You need to buy one that's a trainer and one that's a real one. Now, remember what I said about these being set up to go? You see, this one is connected. It doesn't come like this. It comes at Z-wrapped and just left open. Now, if you're bleeding out, you got 3 minutes or less from your leg being wounded. So, and you're going to be losing an extreme amount of blood. So, one of the best things about this is you keep it ready to go. Okay. Secondly, one of the things you're going to need in your kit, at least, is some sort of compressed gauze to stuff the wound or to cover the wound. I would suggest stuffing the wound. They used to say tampons were great. Now I've heard the latter, but I still keep them around just in case. Now that is the applicator-free tampons. You might look like a weirdo, but anything that can be pushed into the wound and expands and creates pressure directly on the wound will work. Another thing that I like to carry is this right here is a Celox applicator syringe. I rip the bag open, I put the plunger in it, and I actually can inject hemostatic agent. Hemostatic agent means to stop blood directly into the wound. This is the same thing that's in the Celox powders and the Celox sponges, just in a syringe form, which I think is a lot, my personal opinion, a lot more effective. Testing is still out on those. I know they have started issuing them on certain contracts, but they're good. So anything that you can get your hands on, and now Walmart sells them. The Quick Clot, Sports, any of the sponges are great. The gauze is great. If all you can get is the powder is still good. Just remember, the Quick Clot powder creates a thermal effect and can cause chemical burns on your skin or your eyes. You know, you're dumping it on your leg and you wipe your eye. Now you're blind in that eye until it can be flushed. I don't recall any permanent damage being done by that, but it's definitely worth getting maybe a sponge or a gauze. Another thing I have is a hyphen chest seal. Right, this, I'm not going to open this one, but the general idea is for a sucking chest wound, a wound to the pleural cavity. Pleural means your lungs area. When you've been struck in these areas, air will go in, but not necessarily go back out. And it will cause pressure on your lung and cause it to collapse and put pressure. And as that pressure in the empty pleural space pushes, as it sucks in more air, it'll actually start pushing and misaligning your arteries and your veins and your heart eventually. And in very extreme cases, usually you're dead when this starts happening, is your esophagus will go to one side. So this is actually a sticky circle with a valve on it, and you just literally wipe the wound away clean of blood and stick in place, and it will allow air to escape but not come back in. These can be fabricated. Literally, I've got 3 chest seals here because I've got 2 sides of this package and then a chest seal in the middle. So not only, as long as no air can go in, you're doing better off than if air is just going in and in and in and not escaping. Make sure that your pouches are easily accessible. This one's a little bit off. It's not my normal pouch. Another thing that you're going to want to have just sitting around, this usually sticks in the back here. I stick it into the molly. Our little medical shears, they sell them at Harbor Freight. They're $2.99, and they're pretty good. Another items you could have added to this, or maybe what are called the Israeli dressings, the army green bandages that are S-rolled, and you open them up and they're just the standard trauma bandages. Those can be replaced with an extra gauze. They're for dressing the wound. They're an exterior dressing, which is effective on certain wounds. So anyway, that's my short IFAK class. If you have any questions, just post a comment and I'll be ready to answer. I spend a lot of time on my phone, so there you go. Every man tactical out, and stay safe out there.